I think we're approaching, in fact, we are actually at time for this session. I think I'm going to try and just wrap up in a few words, because if I think back to how we started the session, and I mentioned 4 concepts within person-centered care: listening, understanding, adapted service design, and accountability to communities. And I think our 2 presentations between them have highlighted all of those 4 aspects in 2 very different contexts, looking at different elements of what it requires to deliver care in a person-centered way. So I think there were excellent presentations and very inspiring. I want to just sort of finish off by just looking at what's been presented today in the light of some of the lessons that are emerging within MSF practice around person-centered care. And I think just to pick on a few things which have been touched on today. Firstly, looking at staff training, and workshops particularly that encourage staff to reflect on their own experiences receiving good and bad care. And because there's an awful lot of this that requires discussion and reflection, and it's not a one-size-fits-all. So encouraging people to reflect on their own experience brings the richness of their experience from their context, and enables them to more and more think through what it is like to be the recipient of care. To link to that, promoting a culture of learning in general, and in particular, this idea of narrative feedback from patients. And I think we've seen it 2 different ways in which information, knowledge, experiences of patients have been integrated into the programming here. This seems to be an absolutely crucial element for person-centered care. Engaging and working with the community at all stages of the project cycle. Again, that was demonstrated in our first presentation today. And finally, having structures in place for accountability. That can be patient advisory committees, feedback, complaint mechanisms, but again, a crucial element of the chain to enable to close the loop, not just to listen and implement, but actually ensure that what you're implementing is doing what it's supposed to do. And I just wanted to thank my colleague Martia in Amsterdam for sharing those reflections from the work on person-centered care. I'm going to stop there. It's been an inspiring session. Thank you for taking us a big step forward in this challenge of implementing person-centered care across our programs. I'm going to hand back to Aditi for the final wrap-up. Thank you.
Thank you, Kiran. That was well said.